Medication plays a crucial role in managing health conditions and improving the quality of life for countless individuals. In care settings, medication administration is a fundamental aspect of providing safe and effective care. Caregivers are entrusted with the responsibility of ensuring that medications are administered correctly, promoting patient well-being and preventing potential harm. Understanding the significance of proper medication administration is paramount for all caregivers. Medications are powerful tools that can alleviate symptoms, treat illnesses, and manage chronic conditions. When administered correctly, they have the potential to significantly improve a person's health and well-being. However, if not handled properly, medications can pose serious risks. Errors in medication administration can lead to adverse drug events, which can range from mild discomfort to life-threatening complications. The consequences of medication errors can be severe, both for the individual receiving care and for the caregiver involved. Patients may experience a worsening of their condition, unexpected side effects, or even hospitalization due to medication errors. Caregivers, on the other hand, may face disciplinary action, legal repercussions, and emotional distress. In this essay, we will delve into the essential aspects of medication administration in care settings, focusing on the standards set forth by the Care Quality Commission, CQC, in England. By adhering to these standards and best practices, caregivers can ensure the safe and effective administration of medications, promoting positive outcomes for the individuals they care for. In England, the Care Quality Commission, CQC, is the independent regulator of health and social care services. The CQC's role is to ensure that health and social care services provide safe, effective, compassionate, and high-quality care. One of the key areas that the CQC focuses on is medication management. The CQC has established a set of standards that care providers must meet in relation to medication management. These standards cover all aspects of medication handling, from prescribing and dispensing to administration and monitoring. The CQC standards are based on best practices and are designed to protect people who use care services from harm. Compliance with CQC standards is not only a legal requirement, but also an ethical imperative. By adhering to these standards, care providers can demonstrate their commitment to providing safe and effective care. Failure to meet the CQC standards can result in serious consequences, including enforcement action, financial penalties, and reputational damage. Caregivers play a critical role in ensuring compliance with CQC standards for medication management. They are often the ones who are directly involved in administering medication, and they need to be aware of their responsibilities and the standards they are expected to meet. By understanding and following the CQC's guidance, caregivers can contribute to a culture of safety and quality in their workplace. The 5 rights of medication administration are a cornerstone of safe medication practice. These principles serve as a fundamental checklist to minimize the risk of medication errors and ensure patient safety. Every caregiver must internalize and apply these rights diligently. Right patient. It is paramount to verify the identity of the patient receiving the medication. Double-checking their name, date of birth, or assigned identification number against the medication order is crucial. Never administer medication based on assumptions or verbal confirmations alone. Right medication. Carefully confirm that the medication being prepared matches the prescription or medication order precisely. Pay close attention to the medication name, strength, dosage form, and route of administration. Right dose. Ensure that the dose being administered aligns exactly with the prescribed amount. Double-check calculations, especially for medications requiring weight-based dosing or unit conversions. If there are any doubts or discrepancies, always clarify with a qualified healthcare professional. Right time. Administer medication at the scheduled times as prescribed. Be aware of any specific instructions regarding meal times or other medications. If a dose is missed, follow the appropriate protocol and document the reason for the missed dose. Right route. Verify the intended route of administration and ensure that the medication is administered accordingly. Using the wrong route can significantly alter the medication's effectiveness and potentially lead to complications. Administering medication safely requires a systematic approach to minimize errors. Following a clear step-by-step guide ensures consistency and reduces the risk of mistakes. Here's a practical guide for caregivers. Step 1. Preparation is key. Before handling any medication, wash your hands thoroughly with soap and water or use an alcohol-based hand sanitizer. Gather all necessary supplies, including the prescribed medication, a medication cup if needed, water or juice if allowed, and gloves if required. Step 2. Verification and cross-checking. Carefully review the medication order or prescription. Check the patient's name, medication name, dosage, route of administration, and time of administration. Compare this information with the medication label to ensure accuracy. Step 3. Patient identification. Double-check the patient's identity using 2 identifiers before administering any medication. Never rely on memory or assumptions. If the patient is able to communicate, ask them to state their name and date of birth. Step 4. Medication preparation. If the medication is not in unit dose packaging, calculate the correct dose and prepare it according to the instructions. Be aware of any special considerations, such as crushing tablets or shaking suspensions. Step 5. Administration and observation. Administer the medication to the patient following the prescribed route. If necessary, provide clear and concise instructions to the patient. Observe the patient for any immediate reactions or side effects. Section 5. Prompting medication. Encouraging adherence. Caregivers play a crucial role in promoting medication adherence, which means ensuring patients take their medications as prescribed. Prompting medication involves reminding, encouraging, and supporting patients to take their medications on time and as directed by healthcare professionals. Understanding the importance of medication adherence is vital for treatment effectiveness and overall health outcomes. When patients miss doses or discontinue medication prematurely, it can lead to a worsening of their condition, complications, and even hospitalization. Caregivers, as trusted individuals, can significantly influence patients' medication-taking behaviors. Effective communication. Open and compassionate communication is key to successful medication prompting. Take the time to understand the patient's concerns, beliefs, and any challenges they may face regarding their medication regimen. Listen attentively and address their questions or fears with empathy. Establishing a routine. Encourage patients to establish a regular medication routine that fits seamlessly into their daily schedule. This could involve setting alarms, using pill organizers, or associating medication time with other daily activities. Having a consistent routine helps to minimize missed doses. Positive reinforcement. Provide positive reinforcement and encouragement to motivate patients. Recognize and acknowledge their efforts in adhering to their medication regimen. Celebrate their successes and offer support during challenging times. Section 6. Accurate record keeping, a cornerstone of safe practice. Meticulous record keeping is not merely an administrative task, but a fundamental aspect of safe medication practice. Accurate documentation provides a comprehensive account of medication administration, enabling healthcare professionals to monitor patient care, identify potential issues, and ensure continuity of care. Essential information. Every medication administered should be clearly documented in the patient's medical record. This includes the date and time of administration, the medication name, dosage, route of administration, the reason for administration, and the patient's response to the medication. Legible and complete documentation. Maintain clear, legible, and complete records. Use permanent ink and avoid using abbreviations or jargon that could be misinterpreted. Ensure that all entries are signed and dated by the caregiver administering the medication. Timely recording. Record medication administration immediately after it has been given. Avoid delaying documentation, as this can lead to errors or omissions. Real-time documentation provides the most accurate reflection of medication administration. Error reporting. It's crucial to have a clear system in place for reporting medication errors or near misses. This allows for timely intervention, investigation, and the implementation of preventive measures to prevent similar errors from occurring in the future. Section 7. Real-world applications and practical tips. Let's illustrate the principles discussed with some real-world scenarios. Scenario 1. Mrs. Smith, a resident at a care home, refuses to take her prescribed antibiotics. Approach. Engage Mrs. Smith in a compassionate conversation to understand her reasons for refusal. Is she experiencing side effects? Does she have concerns about the medication? Offer reassurance, address her concerns, and involve her family or doctor if necessary. Scenario 2. A new caregiver is unsure about calculating the correct dose of liquid medication. Solution. Encourage the caregiver to seek assistance from a senior colleague or a pharmacist. Never attempt to calculate doses without proper training and understanding. Practical tips for caregivers. Always double-check medication orders and labels. Use a pill organizer for patients taking multiple medications. Keep medications out of reach of children and vulnerable adults. Be aware of common side effects and report any concerns to a healthcare professional. Attend regular medication administration training sessions to stay updated on best practices. Section 8. The importance of ongoing training and competency assessment. In the ever-evolving landscape of healthcare, continuous learning is paramount for caregivers involved in medication administration. Ongoing training ensures that caregivers remain up to date with the latest guidelines, best practices, and medication-related information. Regular training sessions provide a platform to reinforce fundamental concepts, introduce new medications or protocols, and address any challenges or concerns that caregivers may have encountered. Practical demonstrations, role-playing exercises, and case study discussions can enhance knowledge retention and improve practical skills. Competency assessment is equally crucial to verify that caregivers can apply their knowledge and skills effectively in real-world scenarios. Regular assessments, such as written tests, medication administration simulations, and observation by supervisors, help identify any knowledge gaps or areas requiring further training. By investing in the ongoing training and competency assessment of caregivers, healthcare institutions demonstrate their commitment to patient safety and quality care. A well-trained and competent caregiver workforce is better equipped to handle medication administration safely, minimize errors, and advocate for the well-being of those in their care. Section 9. Conclusion: prioritizing patient safety and well-being. Medication administration is an integral aspect of caregiving, demanding unwavering attention to detail, adherence to protocols, and a commitment to patient safety. By embracing the principles outlined in this essay, caregivers can fulfill their roles with diligence and professionalism. Remember, every medication administered carries the potential for both benefit and risk. By adhering to the 5 rights of medication administration, following a systematic approach, and maintaining accurate records, caregivers can mitigate risks and optimize patient outcomes. Furthermore, open communication, patient education, and the establishment of a supportive care environment are essential for fostering medication adherence. When patients actively participate in their care and understand the importance of their medications, the likelihood of positive outcomes increases significantly. Let us strive to create a culture of safety and excellence in medication administration, where patient well-being remains at the forefront of every action we take. By embracing continuous learning, seeking support when needed, and prioritizing patient safety above all else, we can make a profound difference in the lives of those entrusted to our care.